If you're logged into the conference call, you should be able to hear me now. You will not be able to talk during the call, only listen. Please be sure to phone into the conference call, refer to the email for the phone number, or you will not be able to hear the presentation. If you're experiencing any trouble with the audio or video, the webcast will be recorded and a link posted to the PCS homepage listed here. If you have any questions during the WebEx, please send them to pcs@omh.ny.gov or call 1-800-430-3586. I'll leave this information up at the end of the training. We will post frequently asked questions to the PCS homepage and will periodically update it with answers to your questions. All right, we are ready to start. Good morning and welcome. My name is Barbara Brown, and with me is my colleague Louis Solano, who will also be presenting portions of today's Patient Characteristic Survey training. The Patient Characteristic Survey, or PCS, is the largest source of mental health consumer data in the state of New York. In it, OMH gathers data on all clients served in the mental health programs during a one-week period. This year, the survey week is October 1st through October 27th. All facilities in New York that receive OMH funding or have OMH licensed programs and that provide direct services to clients are required to participate in the PCS. Each client who receives a service will need to be reported on in each program that serves him or her during the week of October 21st through October 27th. To give you an idea of the volume, 180,000 individuals received mental health services and 4,000 programs during the PCS week in 2017. So why do we need PCS? Well, the data that OMH collects is used for a variety of purposes, such as deciding how funding is spent, creating new programs, and supporting existing ones. The Office of Mental Health uses the data to apply for federal funding through the Community Mental Health Block Grant, which in turn funds local facilities throughout the state. In 2018, the block grant brought over $28 million into the New York mental health system. And the data collected during PCS is later made available through the public OMH Tableau data visualizations on the OMH website. So I'd like to bring your attention to the facility survey and PCS survey, as some people get these two surveys confused. The facility survey, which you have all hopefully completed at this point, collects data about the providers of mental health services in New York. It's conducted in the spring every other year using the Mental Health Provider Data Exchange, MHPD, application. This application is maintained by OMH, where providers record information about their facilities. The facility survey asks providers to update contact information for the facility, executive director, and program, and to add or close programs in preparation for PCS reporting. The PCS survey collects data on the consumers instead of the facilities. Data provided by facilities on their clients completes the picture of the state of mental health system here in New York. Note that consumers do not complete the survey. Information for PCS is gathered from client records kept by your facility and entered by staff or personnel in the PCS application. Now here's a little review on facility unit site structure. A facility for our purposes is your organization. You may have only one location and only one program, or you may have a number of locations and have programs that cross many counties. But all of that is your facility. Each facility has one or more programs, and we refer to those as units. Sometimes units are further subdivided into sites. So for instance, your facility, Acme Hospital, might have two units, a clinic unit and an advocacy unit, and the clinic might have several locations, the Main Street Clinic and the downtown clinic, excuse me. There are several people at your facility who will be helpful to know during the PCS process. The first is your PCS coordinator. This is the person at your facility who is the contact between you and OMH. Your PCS coordinator is the person to check with if you have questions as to how to proceed in PCS or if you run into problems using the application. Your PCS coordinator will contact us here at OMH to get those issues resolved and get the information back to you. We will also contact the PCS coordinator if we need to get information to or from you. Your security manager is the person who grants users at your facility access to OMH applications. This is also the person to contact if you change your phone number, email address, name, or job title so that your security manager can update that information in our system. And if you should happen to lose your password during PCS, your security manager can reset your password as well. In the PCS application on the home page, there will be links to help you find your security manager and PCS coordinator. Get to know these individuals. They will be a good source for you to have as we proceed in PCS. Now note, if your facility does not have a PCS supervisor assigned, please assign the role by providing this information to your security manager so that they may update the security management system application. If your facility does not have a security manager or you do not know who your security manager is, you can check in the PCS application, or you may contact us immediately at 1-800-430-3586 or at pcs@omh.ny.gov. Now, there are two roles in PCS that users at your facility will assume, the PCS submitter and the PCS supervisor. The PCS submitter is a user who is primarily responsible with entering data for one or more facility unit sites. The submitter is assigned access only to the specific units or sites they need to access and cannot view or edit data for other unit sites. Now, it is possible in a small facility the submitter may have access to all the unit sites, or at a big facility the submitter may only be assigned to one or two, depending on the needs of your facility. A submitter can also view and print reports in PCS for those same unit sites, but no others. Now, the PCS supervisor has all the rights that a submitter has, but for the entire facility. The supervisor can enter and edit data for any unit site and view and print reports for all unit sites. A PCS supervisor can also download the entire facility's data at any point to review and correct it, or save the data at the end of the survey for your facility's records if you desire. The supervisor certifies that a unit site has completed data entry by locking that site when they have finished. Any unit sites that do not submit data must explain why, and a supervisor is required to enter the reason for no data. Supervisors also can upload data from files extracted from facility's own electronic data storage, if applicable. Each facility is required to have, at minimum, one supervisor, as that person can, and in smaller facilities, often does complete the entire process themselves. It is entirely up to the facility how it chooses to assign these roles. Submitters may be clinicians, administrative assistants, nurses, whatever works for you is fine. It is suggested that the supervisor or supervisors should be people who know a bit more about the facility and who can oversee the entire process. Now, directing your attention to the PCS survey, let's take a look at the updates and changes to the survey form since PCS 2017. Question 6, transgender. The response option has been changed to yes, transgender nonconforming. Question 16, preferred language. You'll notice that we added Pennsylvania Dutch and other West Germanic languages. On question 15, resident zip code, we added 5 7s to the list of zip codes and should be used when selecting other state in the United States or other country for residence county option. For question 24, disability or disorder, hearing and visual impairment are now 2 separate items. And then on question 25, for chronic medical conditions, for each of the chronic medical questions, you must individually select no, yes, or unknown. Now, if all information for your chronic medical conditions is unknown, there is a checkbox you can select unknown to select all those items. If a patient has no medical condition, chronic medical conditions at all, you may select a checkbox no for all to select all items. So here are some of the new questions that have been added. We've added a couple of religious questions, religious preference and a religious affiliation. Disability or disorder, we have opiate-related disorder and speech impairment. Cannabis use, we've added for recreational and prescribed, alcohol use counseling or medication, opiate-related counseling or medication, and any other drug substance using counseling or medication. Also, the criminal justice or juvenile status question. The drug treatment court has been added to the alternative to incarceration or ATI status, mental health court and court diversion response option. And the date of client service has been revised to reflect the 2019 survey week, which is October 21st through October 27th. So taking your concerns into account, we have again worked to make the application easier to use. Some of the application changes are that we improved survey layout and design. Questions are now separated into different sections for better organization, and it will also allow you to save sections and complete the rest of the survey at a later time. We upgraded the user interface, the new web page header, footer, and navigation menus. We now have the ability to use Internet Explorer 11 and Google Chrome without having to enable compatibility mode in the browser. Note, if you are using an Internet Explorer browser prior to IE 11, you will need to enable your compatibility mode, and we have included those instructions in the PCS manual. Error messages and validations for survey questions are easily visible next to the corresponding question, which will allow you to quickly identify what errors in sections will still need to be completed prior to submitting a survey. And the reports are updated to support the new survey questions. You will be able to see the changes as we go along today. Now, note that the PCS application will be live this coming Monday, October 21st. Users will not be able to access the application until this time. So how do we get into the PCS application on Monday? Well, you're going to go to make sure you're in Internet Explorer version 11 or Google Chrome, and you're on a PC. At this time, PCS is not supported on a Mac and IE browsers prior to version 11. Like I said, we'll need compatibility mode enabled. To log in, go to the OMH website, which is up here, omh.ny.gov. Once on this page, click on the Behavioral Health Providers link circled here on the screen. Once you click on that, you'll find yourself on the Behavioral Health Resources and Tools page, of which I'm only showing you a portion for training purposes. The Behavioral Health Providers page has several useful links. You can find information about many different OMH programs, including the ones you see here: MHPD, SMS, and of course PCS. You may have to scroll down to see the patient characteristic survey header, and then underneath click on the PCS data collection link. Clicking on this link will bring you to the PCS home page, which looks like this. On the PCS home page, you find various links to web pages that can answer many questions you have after you leave this training today, including the PCS calendar of important events, what's new, the survey form in PDF format, the guidelines, the PCS manual. You will find the link to access the PCS application under the bullet header, the data entry web application. Now, clicking on this link will bring you into the login screen, which looks like this. You want to type in your user ID and your password, which you should have received in 2 separate emails. If you did not get the password, contact your security manager who can get you sorted out. If you have a token associated with your user ID, you can use that, or the password. Either should work. Please make sure you are using your own user ID, not someone else's. If you don't have one, talk to your security manager and they will set you up. Since we are dealing with HIPAA-protected data, we want everyone to be using their own user IDs. Please note, if your security manager has just given you access or changed your password, you may have to wait up to an hour for that information to transmit to PCS. The PCS system refreshes its security data once an hour, so if you can't get in when you first get access, try waiting that hour and make the attempt again. After entering your user ID, and password, you're going to click Continue, which will take you to the PCS application homepage. Now, it is at this time I'm going to hand over the training to Louis, who will discuss how to enter data and use the data application. Louis?
Thank you, Barbara. So once you've entered in your user ID and password or passcode and click Continue, the first thing you may notice is the banner outlined in red, circled here on the screen. This will have important information and updates added by the OMH Central Office as things come up. Check here first when logging in to see if there is any news that may help you out. You may find the name and contact information for PCS Coordinator, Security Manager, and PCS Supervisor and Submitters located under the Help tab. You can go to the menu bar and just click on Help to find your contact information. To keep you aware of how much time you have left, we have a countdown calendar that will tell you how many days you have to complete and lock PCS. Pay attention to the countdown, and please don't wait till the last minute. If you know how much data you have to enter, plan accordingly, and the PCS can go smoothly and easily for your submitters and your entire facility. Also, there is a progress bar, the top bar located on the screen. This progress bar indicates how well your data entry is going. We are comparing this year's number of submissions to those submitted in 2017, so you can see about how far along you are. Please note, if you reach 100%, you may have more to go. This bar does not say you are done, just how well you are doing compared to last time around. If you are a new facility or had no submissions last year, you will not see this bar. The bar that tells you when you are finished is the percentage lock bar. It is located here below the progress bar. Just like in 2017 when you first arrived, it will say that your progress is 0% and the whole thing will be a different color. As you finish data entry for your unit sites and your supervisor locks those sites, the percentage here will go up. Once it hits 100%, all your data entry is complete and valid, and your unit sites are locked, you are done. So what does it mean to lock a unit site, and why do we ask you to do it? Well, a submission entered into PCS needs to be valid. That is, no conflicting answers and no missing ones. To ensure that happens, we ask that a supervisor review the submissions and guarantee that the data entered has been corrected before locking the unit site, both to protect that cleaned up data from being inadvertently edited and to indicate to OMH the data entry has been completed for that unit site. Once all unit sites are locked, you know that your facility has finished PCS. We will show you the locking process a little bit later. Back to the PCS application home page. Next, you will see the table at the bottom of the page, which is a list of all your sites and which gives a quick overview of your facility programs and how data entry is going. At the top of this list, we come across one of the helpful filters available. Anyone logging into PCS can look at this basic information for all unit sites at the facility. But if you are a submitter and only want to see the unit sites you have access to, you can click here on the top left of the screen to limit the list or expand it again. To locate a unit site quickly, use the search box located to the right of the screen. To enter just enter a unit site code or start typing the name of the unit site name, and the rows meeting your search criteria will display. If you have questions as to who has submitter access to a particular unit site, this last column, circled here at the right of the screen, number of users, will help. Clicking on the number in the row you are looking for information about will bring up a list of users who have submitter access. So from the home page, the next thing we are going to do is enter a new submission. If you go to the menu bar at the top of the page and click on Submission, you will see the option to create new submission. Clicking here will bring up the Enter Edit Submission page, which looks like this. On this page, you only need to concern yourself with the items that have asterisks, As you see here, unit name is the first item with an asterisk. Start by selecting the unit from the drop-down menu. If your unit only has one site, then site name will auto-populate with that name. But if your unit has multiple sites, you will need to select a site name as well. Note that once you select unit name, PCS does query the server for the list of sites, which may take a moment. You may notice that the screen blinks, then the site name box is either filled in or a list becomes available in the drop-down for you to select from. This happens in other places in the application as well, so don't worry. A blink only means PCS is asking the server for more information. Once you have selected a unit site, several other fields auto-populate, such as unit and site codes, program code, and program name. You will then continue by entering a client's first and last name here, as well as date of birth and gender. If the client's first or last name is unknown, type unknown in a corresponding box. For example, if you only know the client's first name is Joe, then enter him as Joe unknown. If date of birth is unknown, please enter 99 for month, 99 for day, and put the best approximation you can of year to indicate age. For example, if Joe seems to be 60 years old, enter his birth date as 99/99/1959. Once you have entered this information, click the Next button. PCS will check for duplicate entries, and you may need to scroll down a bit to see that result. PCS checks for duplicates because we want to make sure that there is only one record per person in any unit site. If there is another submission in this unit with the same name, date of birth, and gender, a message will appear here, below the Next button, alerting you to this fact, asking you if you wish to view the other submission to make sure it is not the same person, or if you wish to simply continue to create the new submission. If you are sure it's not the same person, you can continue by clicking on the Create New Submission button. If there is no duplicate client record, you will not see this alert and move on to the full survey. Now, I'm not going to go through all the questions. They are all fairly self-explanatory, but I will mention a few things about them. First, you will find that some questions auto-populate when other questions are answered. For instance, if the client's date of birth were to indicate that he was 6 years old, then we would assume that he does not have children and is not competitively employed or a veteran, and would fill in those answers for you. Please don't try to overwrite those answers. For more information specific to answering the questions, see the PCS website. There you will find several documents, including a user manual and the guidelines for completing PCS that will give you specifics. These documents can also be accessed through the Help menu. Also, here's a little trick as you're filling out the survey. If you see a question that has a little round button, you can only select one answer. But if they have a square button, you can and should select all answers that apply. The questions on assigned sex at birth, transgender identity, and sexual orientation help bring PCS current with other OMH reporting systems, as well as continuing to move New York State into the forefront of these very timely issues. For the purposes of PCS, reporting on transgender and sexual orientation allows OMH to identify underserved populations and to plan for and provide better services statewide. For your facility, asking the questions of your clients gives you a better clinical picture and helps you provide better service for your clients. This information is asked of all clients, LGBT, straight, or otherwise, and, as with all client data, is HIPAA protected and kept strictly confidential. It may be helpful to assure your clients about all three of these elements. One, that this information is asked of everyone. Two, it allows for improved care. and 3 is completely confidential. The OMH Bureau of Cultural Competency has some fine training videos and webinars available to help your clinicians to feel more comfortable in asking these important questions. The link to these will be available in the Frequently Asked Questions on the PCS webpage. As done in 2017, if you are reporting on a client in an inpatient or RTF program, we would like you to report on his or her previous living situation. That is, where he or she came from before entering the program. That means that most of you will not use the option inpatient RTF when answering this question. If, for instance, John came from living in his own home before entering the inpatient program, you would indicate private residence. The exceptions to this would be as follows. If John transferred directly from another inpatient program to yours, or if he had been a resident in the inpatient program for 1 year or more, then you should select inpatient. Use the same guidance when answering county and zip code. Whatever your living situation answer is should be reflected in county and zip code selection. This issue applies only to those clients in inpatient RTF settings. All others report on current living situation. If you answer homeless for current living situation, then use the county of residence prior to being homeless. If you do not know the county of residence prior to being homeless, use the county of the homeless shelter. This year, chronic medical condition is separated out into separate questions. To make it easier on the user, there are now separate checkboxes if all chronic medical conditions are no, or all chronic medical conditions are unknown. Selecting either box will fill in no or unknown, depending on the box selected, for all chronic medical condition questions. Note that by unchecking the box, all responses will be set to blank and you must fill in the responses. In addition to selecting a DSM-5 code and label from the drop-down menu, you can now type either the code or the label to filter the list for the diagnosis you are looking for. Note that a given code may have multiple labels. This is more commonly found in DSM-5. For example, F0280 has multiple labels. In this case, if you can type the label, the list will begin to filter for the appropriate label. Once you have found it, select the appropriate diagnosis. Once you save and reopen the record to view or edit it, the label you selected will be displayed. For admission date, we want to emphasize that for programs that do not have a formal admission process, that you should enter the date the client first started coming to the program. If you cannot determine that date, then select if program does not do formal admission paperwork, check here. The date box will be auto-populated with 8 sevens. When you get to dates of service during the survey week, remember that you only fill out one survey for each client receiving services in a particular program during the survey week, but you must check each day the client is served. If a client is in your program but did not receive services during the survey week, do not complete a survey. The exception to this is residential programs. For these programs, the client is considered to receive services every day, even if you do not actually lay eyes on them. Also, in residential programs, if the client is hospitalized during the survey week, but your facility is holding a bed for them, report on the client as though they were still in residence at your facility during the survey week. Please note, if your facility is closed on October 21st and 22nd for the Jewish holidays, please report clients served on October 28th and 29th in the Patient Characteristic Survey. For those clients served on October 28th and or 29th, select October 21st and or October 22nd for dates of service, where appropriate. So once you've completed a section, you can click the Select Section drop-down, Previous or Next buttons, or the Save button. At any point, you can click the Save button at the bottom of the survey to save the survey and return to it later. Until you do click it, however, the information is not saved, and if you exit the program, that submission will be lost. A note about navigating the survey. Please do not click on the Back button in the browser. You must click the Patient Characteristic Survey text in the upper left-hand corner of the survey screen to correctly maneuver back to the start of the survey. When you click the Save button, you will see a message that tells you the newly created sheet number and says Survey Submission Saved. However, if you left any answers blank or entered conflicting data, you will see a pop-up window that lists all the problems and/or peculiarities in your survey. Once you close the pop-up window, you will notice that beneath each question of your submission, you will still see those problematic and/or peculiar items. Problems appear in red and peculiarities appear in yellow. A problematic item is one that must be corrected for your survey to be valid. For example, if you said that a 6-year-old has a child over the age of 18, we would consider that a problematic item and ask you to either correct the client's age or his or her parental status. Questions that have not been answered at all are considered missing answers, and those are not permitted. PCS does flag those questions as problematic. Peculiarities are answers that may be correct but fall outside of normal ranges. For instance, I have reported that a 97-year-old client has a 3rd grade education. We would consider that to be unusual but not impossible, and ask that you go back and review that answer, correcting if necessary. If there are any problems or peculiarities, they will also appear in the drop-down menu as well. If there are problem and/or peculiarities, you can only use the drop-down menu to move back and forth through the survey. The sheet number and green Survey Submission Saved appear whether there are problems or not. From here, you can do a couple of things. To make corrections immediately, you can click the Edit button, which returns you to edit mode for this submission. When finished, click Save at the bottom just as you did the first time. If you need to move on and come back to this submission later to make corrections, you can choose either the Create New Submission button to move on to another new submission, or the PCS Home button to return to the home page. Some programs and facilities use other OMH reporting systems to track client data. 2 of those are CARES and MARS. If you report in either of those systems, most of the client information will import directly into PCS for those applications. When you choose a program from the unit and site lists that report in CARES or MARS, PCS will query those applications for a list of clients who are on the active roster during the survey week. When PCS finds the client list, this information will appear here with a drop-down list from which you must select a client. Click on the list and select the client you are looking for, and quite a bit of survey information will import from CARES or MARS and fill in many of the questions. When you click on the drop-down, PCS will display a list of all clients currently admitted to your program. On the client list, note that if a client already has a survey entered in PCS, a sheet number will appear in the sheet number column. After selecting a client, you must continue with data entry, as not all answers are imported and corrections may need to be made. Click the Next button at the bottom of the screen to continue on to edit the survey and make corrections. When finished, be sure to click Save at the bottom of the survey to save the data. Please note, there may be times when the system may be slow. If you experience issues importing CARES or MARS, try importing during non-peak times, that is, morning, midday, or late afternoon. If the client you are looking for is not on the list, it may indicate the client is not listed or the form is not confirmed in CARES or MARS at all. If they should be, you should go back to those systems and report on those clients and check to see that the admissions form is completed and confirmed. Then when you reopen the PCS application, the client's name will be displayed. What you can do, however, is add the client directly into the PCS at this time without returning to CARES or MARS. Above the list of clients is a button which will give you the option to add a new client to PCS. After selecting this option, continue entering the client's information as you did when completing a new survey manually. Note that this information will not transfer back to CARES or MARS. You must go back as soon as you can and add the client there. You can find the list of submissions in several different ways. Going back up to the menu that appears at the top of every page and choosing List of Submissions under the Submissions menu will bring you to this list, which currently displays all submissions for the entire facility. From the home page or from various reports, you have the option of opening a list of submissions that is already filtered for one unit site. If you are a submitter, you will only see a list of submissions for those unit sites you are entitled to view. When you arrive here at the list of submissions, you have the further option of filtering the list using this filter box. Enter the unit and, if necessary, the site you are looking for. It is recommended that you do use this filter function, especially if yours is a larger facility with many submissions, as attempting to sort a large list of submissions may take some time and may cause the system to time out. Also, if you are a submitter, the filter box will only list unit sites to which you have access. A useful feature accessed in the table allows you to view, edit, delete, or copy any record. Click the link for each function in the row of the record you wish to see. View if you just want to check it over, edit if you need to fix a submission, delete if that submission should not have been entered. For instance, you realize that the client was not served during the survey week and was entered inadvertently by an over-exuberant submitter, and copy, which I'll get back to in a minute. Please note that the edit and delete links are sometimes missing. When that happens, it is because the unit site is locked and submissions in it cannot be changed. If you need to edit or delete a submission in a locked unit site, have your PCS supervisor unlock that site. You can still view submissions in locked unit sites and then copy them to other unit sites. Located at the bottom left corner of the screen is the print function. We have improved this function. You can print one or a range of submissions. Remember, do not send paper copies of surveys to OMH. We are only accepting electronic submissions. This feature is strictly for your use. If having paper copies of your submissions would be useful for your records. So let's explore for a moment the copy feature. The copy feature is used when a submission has been entered under the wrong unit site, or when a client has received services in more than one unit site. Previously, the submitter would have to manually enter the entire record a second time. Now, much of the client's data can be directly copied from one unit site to another. Remember, there should be only one submission for each client in any one unit site, but there must be one submission for the client in each of the unit sites where services are received. When you choose the copy link in the row of a particular sheet, a box will appear directly below the list of submissions. Check to make sure that you have selected the correct sheet and client. Then, use the drop-downs to select the unit and site you wish to copy this submission to. If you do not see the unit site you are looking for, you are either a submitter without access to it, or it is locked and cannot be edited. Once you have made your selection, click Copy Submission, and the sheet will be copied into the second unit site, and a new sheet number will be assigned to the new copy. When you make a copy, some information specific to the new unit site is not copied. Diagnosis codes and labels, all dates of service, and admission date are not copied. You must go and edit the newly copied submission to answer these questions in order to make the new submissions valid. You can do so immediately or after completing other copies as needed, but this must be done or the unit site cannot be locked. When you choose Copy Submission, PCS checks to see if the copy will duplicate another record in the unit site you're copying to. If PCS thinks there is a duplicate, another selection appears in the same box, just like the duplicate alert you received when entering a new submission that we showed you earlier. If you need to check the already existing record, you can click View to bring it up. If you know that this is not the same person, you can continue with your copy by clicking Continue with Copy. Note that the original sheet is not deleted. It remains in the old unit site where it originated. If you need to remove it, you must select the delete icon from the same row in the list of submissions. You will be asked to confirm, then the sheet will be deleted. And either way, if you copy a submission or cancel copying, you are returned to the list of submissions. I will turn it back over to Barbara for the QA reports.
Thank you, Louis. Now, once you have completed your data entry, or perhaps while you are in the process of doing so, you may want to check out the quality assurance or QA reports that are available to you. As I mentioned earlier, the data we collect is used for many important purposes, from applying for funding to designing new programs, but the data is only useful if it is good quality data. For that reason, we require that some answers be resolved by you before the data can be submitted, and we strongly encourage you not to overuse unknown as an answer. To that end, we have several reports that can help you monitor the quality of the data you are submitting to us. From the menu, select QA reports, and you will see the list of 4 reports that we have made available to you. The first report is the % valid submissions by unit. This shows users a list of unit sites and tells them how many valid and invalid submissions are in each unit site. The user can click on the number of submissions and be taken to the filtered list of submissions for that unit site. Then click on each individual sheet to edit that sheet and make corrections. The second report is the % of unknown responses by unit site. This is the same as the report card that your facility has been sent in past years, tracking your % of unknowns as compared to all other programs of the same type in the state. We do realize that some program types will have a higher % of unknowns simply because of the sort of information they normally collect. But in all cases, the fewer unknowns, the better the data and more useful it is. And so we encourage all programs to do their best when recording and collecting data and when entering it to avoid the unknown response. To help your facility figure out what information you are not collecting but perhaps should be, the third report is % of unknown response by item. This will show patterns of unknown usage, allowing you as a facility to see what sort of information you have not been tracking in general. Just select the unit site and name and click Apply Filter to see the report. And the fourth report, number % of responses by item for uploaded data. For some facilities that use the Upload Data feature, this page gives a summary of responses for each item by counting percentage for the whole facility. For users who upload files, this is a good tool for finding unusual responses within their batch of uploads. For example, if 80% of clients were aged 100 or more. The users can promptly edit the uploads to correct selections with the new upload. All uploads before the newest will be deleted from data records, so you do not need to worry about double counting the clients. When you access the PCS, I recommend taking a look at these reports just to see how they can be useful to you as you complete your data entry. Let's take a look at functions available on the Supervisor page. The Supervisor page is only available to those in the PCS supervisor role. In fact, the submitter won't even see the supervisor menu up here at the top of the page. Clicking on the supervisor page brings up this page here, which has similar information to that on the home page and some additional features. Note that the percent of unit sites that are locked appears here. If you are a supervisor and are wondering if your facility has completed PCS, you can check this percent or the one on the home page and tell immediately if you are done. Let's look at the list of units. Checking the unit site locked column will let you know which unit sites are done and locked and which still need to be completed. A unit can only be locked when all submissions are valid. If you look on the table in the Submissions 2019 column, you will see the number of submissions that have been entered for that year. If the number and the cell background is red, if the number is has an asterisk and the cell background is red, there are invalid submissions for that unit site. And clicking anywhere within the cell with your cursor will bring up a tooltip that will let you know how many there are. Once all invalid submissions have been corrected and made valid, then you can lock the unit site. To lock, simply click anywhere in the row of the unit site you wish to lock, and a box will appear below the list. You may need to scroll to the bottom of the page to see the lock function. In that box, you will see the option here to lock the unit site. If the unit site is locked and all the submissions are valid, you can click Yes, Lock to lock the unit site and you are done. If you discover that you have locked too early or more entry needs to be done or more corrections need to be made, you can easily unlock by clicking in the row of the unit site on the table, and when the box comes up, just click Yes, Unlock. Remember that once you have finished again, you must come back in and click on the Yes, Lock button again once more. Sometimes a program will not have any data to enter. If that is the case, the PCS supervisor must enter a reason for no data. So when you select a unit site that has entered no data, as you see here, instead of the option to lock, you'll get this message. When a unit has no submissions, you must provide a reason for not submitting data. There are several reasons provided in the drop-down menu shown below, the first one being the unit site is closed. What that means is that the unit site is no longer in operation, that as of the first day of the survey week, it was defunct, no longer funded, and or is no longer serving clients. If this is the case, you must also close the program in MHPD and should do so immediately if it has not been done. The second option is that your unit site served no clients during the survey week. If yours is a seasonal program that only runs summers or only serves a couple of clients a month, this might be the case. If you have hundreds of clients, we're going to question your use of this answer. Now, once you have selected one of these two answers, click Save to submit that answer to OMH. Your program will then be considered locked. The third option, if neither of the other two fit your circumstances, is other reason for no data requested. Now, when you select this, a text box will appear below with instructions. You must briefly answer 3 questions. We need to know what services are provided by your unit site, what information, if any, you collect on your clients, and why you cannot report data to OMH. Once you click Save, this answer will come back to us for review. Your unit site will be marked as pending, and you won't have to do anything further until we either contact you for more information or make a decision. Please be brief but specific in your request. You have a 1,000-character limit. Once you have selected any reason for no data, the next time you click on that row on the table, this additional bit will appear below. If you discover that you have data to submit, you can click Remove Reason, which will delete the reason you have entered, unlock your unit site, and you can then enter data. We have several different responses to your request to not submit data. The first, you might see when checking the supervisor page, a pending, as you see here circled. This means that we are still reviewing your request and have not made a determination. We may contact you for more information, or we may make a decision based on what you have already provided. If your reason is not sufficient, then we may deny it. As you see here in the middle of the screen, other reason for no data denied. If that happens, you will need to submit data for the unit site. When OMH enters other reason denied, the unit site is automatically unlocked and data entry can proceed directly. Or we might approve it, in this case, seen here circled below, other reason, no data approved. If that happens, you are done, the unit site is locked, and your responsibility is finished. Our goal is to take a few days to determine each case. When OMH enters a response, either approved or denied, an email will be sent to the PCS supervisor who submitted the request, informing him or her of our decision. Now, at this time, I will turn the presentation back to Louis, who will discuss uploading and downloading data and wrap things up. Louis?
Thank you, Barbara. So, at any point in the data entry, you may download all the data your facility has entered to date by clicking the Download Facility Data button. It is not required that you download your data, but you may do so if it will be helpful to your facility. The data will download to your computer in a protected Excel spreadsheet format. The Excel spreadsheet will be password protected. The password will be PCS 2019 _ and your user ID. This will be in all uppercase letters. If you wish to make changes to the Excel spreadsheet, you will have to change it to unprotected. You may find it helpful in locating records that need to be corrected. Remember, it's entirely up to your facility to determine if it would be useful to download your data and have entered your data after you have entered it into PCS. Facilities that store their own records electronically may find that it saves them some time to extract data from those records and upload it into PCS. In order to do this, you must be able to manipulate your data to conform to our specific standards, which may take some time in programming, which is why it's not recommended that smaller facilities with only a few records to enter bother with this process. However, any facility may choose to use the upload feature. Only a supervisor can upload, and you do so by going to Upload in the Supervisor menu. That will bring up the page you see here. Select the unit site you're going to upload to by clicking the appropriate selection boxes. If you choose a particular unit site, the unit site code for that unit site must appear in your upload data. You can upload to each site individually or put all your data into one text document to be uploaded all at once. Select the entire facility by clicking the checkbox above the table, or individual unit sites by clicking one or more boxes in the Upload Data column. Note that a box which is grayed out simply indicates the unit site is locked and unavailable for uploading. Go to the Supervisor page and unlock if necessary. Once you have selected the unit sites you wish to upload to, click Next, and you'll see a box to enter the file name. Use the Browse button to search your computer for your data file. Your file must be formatted correctly. There is a file layout document on the PCS webpage that shows you the correct layout. Your file must also have a .txt extension at the end of its name. The file you are selecting will be in block format as shown here. Basically a big long string of numbers and letters and some blank spaces as padding, but it has to be exactly this or it won't work. For more specific information on formatting your data, see the documents available on the PCS website. After you have selected your file, click Upload Now, and the file will be uploaded. Your data file will be rejected if you have selected unit sites for which there is no data in the file, or have data in the file for which a unit site you have not selected. It will also be rejected if the record is not exactly 212 characters long, or if there's a problem with name, date of birth, or gender. Other than that, all records will be accepted, but any answers that fall outside of the acceptable range of data will be deleted and show up as missing in the PCS. You will be required to go back into those submissions and correct the data as necessary to make the submission valid. Something to note, if you upload data and discover that there are too many mistakes and you want to go back to your original data to correct them, you can do so and then re-upload your data. Be aware that if you do so, any data that was previously uploaded to that unit site or sites will be deleted. That is, the first set of uploaded data is removed when a second set is added, even if the second set is different clients. So you want to make sure that you do your entire upload for any one unit site at once. Submissions that are entered manually will not be affected by this process, but uploaded submissions will be, even if manual corrections have been made to them. Again, the best thing to do is carefully read through all the supporting documents on uploads on the PCS webpage and the help menu in the PCS application itself. After you are 100% locked, you will find a link to the User Satisfaction Survey, both on the Supervisor page and on the PCS application webpage. Please fill out the survey to let us know how things worked for you. We take this information into account each time we do PCS so that we can make the application work better and make data entry easier for you. Please ask that all PCS users at your facility to take the survey as well. You can either click on the link and forward that web address to them, or ask them to pop back into PCS and click on the link on the home page for themselves. Either way, your comments can only help to make improvements. Also note that the User Satisfaction Survey will be available beginning when we go live on October 21st. I do hope that this presentation has answered most of your questions and has given you a good jump on completing PCS 2019. For more information, please refer to the PCS webpage. The address is shown on the screen, www.omh.ny.gov/omhweb/PCS/submissions. This includes a lot of other useful information that will help you out. We have a frequently asked questions page as well as a user manual, which, like this training, is full of lots of illustrations and easy to follow directions. There are documents to assist you with uploading, and you will find a link to a recording of this training session. Please check this webpage first if you have any questions, as it is very likely that you will find your answers there. If you have any questions or issues with PCS, call our help desk at 1-800-430-3586 or email us at pcs@omh.ny.gov. Thank you for attending and have a great day. Bye now.
Bye.